charting. That's why you went into healthcare, right? Was so that you could chart? Absolutely. Not at all. It's actually the worst part of my job. Maybe not the worst. It's up there. Anyway, welcome. Today's video, we're going to be talking all about how to write a SOAP note or whatever kind of charting you're doing as a provider of really any type. I'm a family nurse practitioner, and I'll be walking you through kind of a typical case that I usually will see in office in primary care. We'll be going through examples of like how I document, what information to put where in the document, and at the very end, we'll wrap up and I'll give you some tips and tricks of things that I've kind of learned to help make charting a little bit less painful. It doesn't solve it all, but hopefully it will help you just a wee bit. Alrighty, well, welcome. If you're new here, I'm Liz. I'm a family nurse practitioner, and I work in family medicine. So the case we'll be doing will be kind of a traditional, like what I would normally see a regular appointment in my office, dealing with a lot of chronic conditions. And in order to help us document today, I'm going to be using this template that I made. At work, I would use the computer. We have an electronic medical record. It has a lot of this information on it. However, when I was in school, I often didn't have access to a computer. And sometimes when our computers go down, I need something to write on. So I have this, and you'll be able to document everything on it if you need something like this. It is available in my nurse practitioner binder. I'll leave a link to that down below. That's kind of my like resource binder I use in primary care, like notes of things I've learned, links to a bunch of different resources. It's all digital. If you already get the NP binder, you get free updates once you get it. I'll send an email out and you should get it that way. So if you have that and you haven't gotten it, just shoot me an email. But that's where it will be, or you can make your own because you're gonna see the whole thing anyway. So you can also do it that way. But let's dive into this and I'll walk you through the process. I'm gonna scooch over so my paper can hopefully appear on this side of the screen. All right, so we have our document. Now the point of this is you could either print them, like print a bunch of the blank ones off and you could take it to clinical and write everything down. That way you could document it later, write whatever note you have to do on it, give you a little bit of structure to work off of when you go in the room. And you can also pre-chart on it. And all pre-charting is writing notes for yourself, that like questions you definitely want to ask the patient or anything that you really want to make sure to include or remember when you're in the appointment, and you can write it down. I also used something like this in school to take home when I had to log my thing for Typhon. Anyway, okay, so at the very top, you're gonna see all the normal stuff. So we're going to put the patient's name, the date that the appointment is, and the reason for visit. So in today's reason for visit, we can do just like a med check. And a med check at my office is anytime someone has an appointment just for like maintenance stuff. You know, maybe they have type 2 diabetes, hyperlipidemia, hypertension. Let's go with those for this patient. It's a very typical triad in primary care. And they're just coming in just to make sure everything's okay. You know, if we need to do labs, answer any questions that have come up, it's going to be one of those types of appointment. So we'll put med check for the reason of visit. Next, we're going to import all the information, probably from the computer or wherever their chart is, about the visit today and a little bit of their history. So we're going to have the vitals. You could highlight them if they are an abnormal value for you. Sometimes I'll do that, or like circle it. If I want to remember like, oh, their blood pressure's high, I'll circle it so that I would remember like, I need to address that in the appointment. Medications, pretty self-explanatory. This is part of that pre-charting where hopefully you were able to write down all of their meds. Obviously, if you're working on an electronic medical record, this is already in there and all you have to do is merge it in and verify it. I think the rest of the stuff here is pretty self-explanatory. Medical history, surgical history, allergies, family history, pertinent stuff for your visit. Social history, big things you're gonna wanna know there are they a smoker? If so, how long? Were they a previous smoker? How long ago did they quit? What was kind of their smoking pack year history here? What's their alcohol look like intake in case you're doing anything that would involve that, or you need to, if it's a physical and you know you just wanna check in and know. And are they using any other types of drugs, illicit substances, anything like that? And that's kind of the basic like background history. That's, I feel like, very standard. I broke it down on the document just so that you would remember, because sometimes when you like, there's just so many things to ask if you're asking all these things that it just gets lost, but all of that's pretty self-explanatory. Now let's dive into the HPI. So the HPI is the history of presenting illness, which is like, what is going on? What's a little bit of the history here? This is subjective information. So this is all data that is kind of the patient is providing you, or the history of what's been going on. It's not you observing anything. There's no vitals here. There's no labs. It's just kind of the story of what has been going on. So for our patient today, the history of their presenting illness is like a med check for their chronic condition. So I will list out 1, 2, 3, 4, let's just give them 4 today. 1, hypertension. 2, hyperlipidemia. 3, type 2 diabetes. And 4, actually, no, you know what? For the sake of being easier on this video, let's just do 3. All they've got going on is those 3. But anything else kind of that you're going to address in this appointment, you could list on 4, 5, 6, 7. Now, you don't have to list them numerically. That is just what I have found to be the easiest. I write all of those things down. All the things we're going to be addressing, anxiety, depression, all on and on, everything, really everything could be on that list, but that's how I organize those. Now, let's talk about what kind of goes under those bullet points, and then we'll take a little bit of a step back and I'll give you some tips for doing this because you can make your life a little bit easier on yourself in this area. So under all the bullet points, like 1 being hypertension, high blood pressure, under that you're going to say patient is taking lisinopril, tolerating it well. And then you could go on and list, what do they check their blood pressure at home? Checks their blood pressure at home 1 to 2 times a week. It typically runs in this range. And then I'll usually ask them some questions about like any headaches, vision changes, anything like that, chest pain, shortness of breath. And you could list that, like denies, all of these things, or you could just put that in your review of systems. I tend to overchart, so you could definitely just put that in your review of systems, but just kind of an update about their blood pressure. Now, let's say for today's example, going back, that their blood pressure was elevated when they came in and we saw that. So we circled it and now we're going to talk about it with them. I'm going to ask them some questions because just because this is the subjective where the patient, it's like patient information, you're allowed to ask the person and anything that they give you goes in this section. So, and we're going to do all of that with our open-ended questions. So, hey, what has your blood pressure been running at home? If they have a monitor, how has your mood and stress level been recently? Those things can elevate it. Have they started smoking? Have they gained weight? Any of the other things that can raise your blood pressure, eating a lot of salt, anything like that. Ask them those things. And then you can write, you can document that they admit that they've been having, eating out a lot more fast food. They've noticed they've gained a little bit of weight and they've been incredibly stressed because we're in the middle of a pandemic. So all things that you'll be like, yeah, your blood pressure might go high, but it's just what they're reporting. But no, they don't have a headache. No, they don't have chest pain. No, any of these other symptoms there. Again, no objective, no plan. We're not talking about anything going forward. It's just hey, this is kind of where we've been. And this is, I won't even write blood pressure is high today. No, because that's something I'm viewing. It's literally just you saying, here's been the plan before. This is what their blood pressure has been running kind of at home. And, they're feeling stressed. And then in terms of charting, you move on. 2, hyperlipidemia. They have been taking 20 milligrams of atorvastatin, tolerating it well. It can be very short and sweet here. You can always elaborate if you find something else to be really helpful, but mostly short and sweet is good. And then you'll go on to your 3rd point, type 2 diabetes. Patient is on 1,000 milligrams of metformin, BID, tolerating it well. If they check their blood sugars, you could update what their blood sugars have been. If they don't, leave that out. I would probably chart denies polyuria, polydipsia, polyphagia, but you could also just chart that in your review of systems. Hasn't had any noticeable episodes of hyperglycemia, hypoglycemia. Do they go to endocrinology? Have they been to endo lately? Anything that kind of fits in with that. Now, in any of those sections, you could always talk about what their exercise and diet has been like. Maybe if all of a sudden their blood sugar is really wacky and they're like, oh yeah, it's winter, I haven't been able to exercise because I don't have access to somewhere safe and dry to walk. Okay, you could put that in there. It's something they're telling you that's affecting their health. But basically this section is there for you to give the history, in case I haven't beaten that over the head. Other examples of this real quick would just be if you come in with a sore throat, you wouldn't have any of this other history in there. It doesn't matter if they have high blood pressure because their appointment is for their sore throat. So you would just have 1 and it would be sore throat. And then under it, you would say, then you would go through all of your, when did it start? How bad is it? All of your old cards questions. Onset, location, duration. Let's see if I can remember. Onset, location, duration, things that make it worse, things that make it better, radiating, timing, and why they came today. I don't know. I might be missing one in there. I don't think through the letters anymore. Not to brag. Anyway, that is your HPI in a nutshell. Now, things that can help you is you can pre-chart that if you're doing it on paper. You can write 1, hypertension, lisinopril, 20 milligrams, so pre-chart that so you don't have to write it down later. And then you saw, oh, their blood pressure was high that we saw and we circled it. So you could write stressed question mark, less exercise question mark, anything else you want to ask them about it. write the question out there. So all you have to write is like yes or no when you're actually in the room. And again, you can do that with your electronic medical record or this. I will write, especially when I was a new nurse practitioner, I would write out, if someone came in with like left knee pain, I would be like, okay, what questions? I would go to my assessment book and I would write down what questions I need to ask them. And I would write down like, ask them this question. And if they say yes, that means it's more likely to be this. Ask them this question. And if they say no, then that also supports that. You know what I mean? Because I didn't know. So I would write myself notes in the HPI to guide my questions that I was asking my patient and then let myself know, like, if they say this, this is what it probably means. So feel free to do that in your HPI and then just kind of clean it up before you actually submit the note, because that doesn't, it's helpful for you, but doesn't need to be there forever. All right. I think that was our most complicated section, hopefully. Let's move on to the review of systems. And your review of systems is where you can kind of say, where I had asked, like, do you have chest pain, nausea, vomiting? When you're asking all those other symptoms related to what you're already talking about, this is where you can write that. That way, so you're not double charting like I often do, where I'll say like denies all this stuff and then I'll write it again in the review of systems. This is where you actually write that. So as you're doing your check-in with them, you're like, oh, with your hypertension, do you have headache, vision changes, with sore throats? Do your ears hurt? Does your head hurt? Do you have a fever, chills? Any of those things, that's where you can document this. And when you're documenting it on the computer, it is very easy because everything is listed for you and you can just go through and be like, click, 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 click. Side note, fun fact, that is a really good place to go if someone comes in with a chief complaint and you're like, I'm not really sure what else to ask you. Identify the body system that they're talking about. So if they come in and they're like, yeah, my eyes seem weird, go through your review of systems real quick, see what part asks about the eyes and ask them all the other questions on it. So it'll be like the ophthalmic section and then the neuro section, and just go all the way down the list and be like, are any of these other things happening to you too? And you don't actually have to remember it. Just a fun fact. Not going to be as helpful if you're doing paper. If you are charting on paper, only write down the things that are weird. Ask them all the other questions, but only write down the things that are weird. That way you're not writing a billion things down. I will write plus and then minus on one side, and the plus is symptoms they do have, the minus is symptoms they don't, and I just go over the basic ones. Most of mine are like things that stand out, so I won't write down everything because you would be writing forever. So with my, blood pressure patient, let's say they are, they're not having headaches, so I'll want to remember that, so I'll be like, and no headache, no whatever. And when I document it in the computer or the actual documentation system, I'll fill out all the associated sections, but I'll know to write like a normal exam, fill in a normal rest of the review of systems for this person. And that these are just kind of the outliers. So what if they did have a headache? Then it would be like positive headache, positive vision changes. You don't want those things, but as an example. And with the review of systems, you're really only reviewing the systems that you have that correlate to the 3 things that you charted about. So you don't need to be writing about the genitourinary tract necessarily if, you don't need to ask those questions. It's just probably like heart, lungs, endocrine, overall, maybe psychiatric for like the mood. You don't need to go crazy here. And that's kind of review of systems. Again, don't write it all. Makes it much easier if you actually have the computer. Great place to have a template. I have a normal basic review of systems template for like hypertension, patients with diabetes that I just merge in, and all I have to then change is the things that are a little bit abnormal for this specific person. We'll talk about templates a little bit later, but that's my basic approach. Next, the physical exam. This is where you are putting your first objective data. So review of systems and HPI are subjective. It is what the patient is telling you. And your objective sections are the ones that you are actually measuring. Vitals, physical exam, labs, all things that you yourself are kind of assessing or the other staff are assessing. Okay, so under your physical exam, here is again a thing where you're just going to write the pertinents that are maybe abnormal or that shouldn't be there, or you want to make sure to really include on this actual document if you're using this, or when you're charting in the room. Just get the ones that you definitely want to talk about or that are weird. So again, in a sore throat, you would be writing that their throat is erythematous, maybe their tonsils are swollen, maybe there's exudate from the tonsils, they have some lymph nodes, and they have some fluid in their ears. Those are all things that you would want to definitely note. So I would click those boxes while I was in the room or right after I left the room, and you can leave the rest blank, and that tells yourself that the rest of it is all a normal exam. Obviously then go back and fill in all the rest, like I said, but on your charting while you're in the room. It keeps you from writing like absolutely everything and saves you a couple minutes of time if you're in a rush. And one more thing about the physical exam is your physical exam should kind of mirror your review of systems. Whatever your sections and body systems you talked about in your review of systems, those are the systems that you should be looking at in your physical exam. You know, if you are saying, no, they don't have chest pain, they don't have palpitations, they don't have orthopnea, you should really be looking, those are all cardiac review of systems questions. So you should listen to their heart. You know, did you ask them questions that could be about their thyroid? Feel their thyroid, you know, just like things that's how you kind of figure out like, what are you doing in your physical exam is what you ask them about in your review of systems, which you can always just go through the questions and realize, oh, I am asking them about their genitourinary tract in case you weren't quite sure, like what section am I even asking about? But that's pretty much it for your physical exam. Okay, next, recent lab work. This is just more for you where you could fill it in and be like, oh yeah, their hemoglobin A1C is 6.5 or it was 8. Again, circle it. You could write like an arrow or a down one. You could write the reference range if you want to, just so you know when you're talking about them with them. I always print my patient's lab work out for them and then I highlight any abnormals. That way I remind myself of it there. But you could like highlight it on your paper or circle it or write hi next to it so you know you have to do something. For the case of today, our patient's A1C was great. It was 6.5. So we don't have to worry about that. They're doing wonderful. It's just their blood pressure that we're worried about. But you can write their recent labs there that are pertinent. Again, not all of them. I would honestly probably just do the abnormals and then you could always print their lab work too. But when I use this, I just write their abnormals so that as I'm going through it, I'm like, oh yeah, we got to talk about that. And that is kind of all the information that we have acquired from our patient. Now, the differential diagnosis. If you are charting in an electronic health record or even paper, there is not a section for this. So don't go looking for it and be like, I don't see the differential diagnosis section. It does not exist. But I put it on here because it's very important and I include it somewhere else and I'll tell you where, like in my actual charting. But on here, it just made sense to give it its own area. In school, when you're writing SOAP notes, there's always a differential diagnosis area they want you to write. And those are all the things that these things could be. That doesn't apply quite as much in our case with like our high blood pressure, cholesterol, and type 2 diabetes. But say they're coming in with a sore throat in our alternate universe, and they, you know, we're thinking like, do they have strep throat? Do they have mono, seasonal allergies? This is all the different things that you think it could be, and you write them down. Now you could always grab a different sheet of paper and write like, here's why I think this, here's why I don't think this. You can go to your differentials book. I'll leave a couple resources down below of one like good books for kind of working through your differentials in terms of like, this is the symptoms, what could it be, and how are we gonna decide? But this is just, all this is where you list all your different ideas. Next on this sheet is your assessment, and this is what you're gonna go with. It's also called your working diagnosis. In a charting system, it will be called your assessment. You got to pick one and go for it. You can like give yourself a little bit of a backup in a minute and be like, if it's not this, here's also what we're thinking about. In our patient, we have 3 different things that are going on. It is your hypertension, hyperlipidemia, and your type 2 diabetes. In our other patient, maybe we'll say like, I really think this is strep. This is also the part where you write your diagnosis code. So your ICD-10. So hypertension, I-10, hyperlipidemia, E79.8. I'm not sure on that one. And diabetes mellitus type 2 is like E60 something. Oh, I should probably know that. But if you're in an electronic health record setting, this would be where you type in the diagnosis and it'll come up with the name for you. And on here, you would type the name and then Google ICD-10 code for whatever you're looking for and list all of them. So in our case, we have 3. In a strep case, you might have 2. You can have multiple ones. Most charting systems will limit you to like 12, I think, assessment or like ICD-10 codes. So like 12 things, because really, how are you talking about more than 12 things? That seems impossible. But patients try to do it. They try to do it. So you can list multiple things here, but every problem should really try to have like one kind of focus. So all of our 1, 2, and 3 up from our HPI should really correlate with kind of one thing down in our assessment section or our working diagnosis. All right, we are almost in the home stretch here, friends. We've asked them what all these struggles are. We've gotten the history. We've actually come up with different things it could be. We've picked one. And now we just need to tell the computer or paper what we're gonna do about it. So again, all of this will be listed. If you're writing it on paper, I would do it numeric. 1, I-10, hypertension. Here's our plan with this. 2, hyperlipidemia. In a computer system, it'll be under like little different sections and kind of you'll write it in a box under each one. But here's where you just kind of say like, here's what things are and here's the plan going forward. I like to write it as a note to myself, like just be kind to yourself or anyone whoever might read it. And I kind of give like what is happening now, what might happen in the future, and like alternate universes. We're going to talk about each treatment. So we're doing hypertension right now. So I would have like a little number in my actual charting. I write it numerically, and each number kind of gives a different part of the plan. So 1 is usually the state of things. So I will say blood pressure elevated today to whatever it is. Filming that part in the future, so we don't know yet. Blood pressure elevated in the office today, rechecked at this, so it was still high. Monitors at home and has been running this. So my line number 1 is usually always the state of things. Line number 2 is usually medicine. And in this case, we're going to increase the dose because we talked about it with the patient and they felt like right now, maybe during a pandemic or whatever is stressful, like their blood pressure is high, we need to control it. And they would like to go up on the dose for now, and they're going to implement lifestyle changes. 2, so we'll say increase lisinopril from where you are, 20 milligrams to, let's just go to 40. We're going to be bold. 40 milligrams daily medication and decision discussed with patient and decided this was the way to go. 3, we're going to say continue with lifestyle changes, discussed salt intake, activity, and balanced diet. 5, monitor at home if more than 3 readings greater than X, Y, and Z. We'll talk about templates in a minute, but that's huge here. And then we're going to meet up with them in 6 weeks and just see how everything is going. So then 0.5, follow up in 6 weeks. If more than half of the readings at home are still greater than 1/90, call office. Kind of the plan for that exact thing. Move on to hyperlipidemia. Last labs were from 5 months ago. On line number 1 under there, I usually will have labs pertaining to what is going on. So again, the status of things. So I'll have total cholesterol and all of that. Line 2, continue with the atorvastatin 20 milligrams. 3, kind of copying the same stuff like lifestyle encouraged, yada, yada. And then maybe here we'll say, hey, since you're coming back in 6 weeks and we haven't had labs in about 6 months, why don't we check them? We'll check your cholesterol and we'll also check labs related to your type 2 diabetes. So under line 5, it would be obtain lipid profile. 6, follow up in 6 weeks. Type 2 diabetes, same exact thing. Here's what their blood sugar was last time, their A1C. Do they check it at home? I would write that on line 1. Line 2 would be continue metformin BID. 3, go on and on, other things like general education related to diabetes that you talked about. And then 5, we'll obtain A1C or BNP, whatever you want to get prior to next appointment, follow up in 6 weeks. Now that was very long-winded. Good on you if you're still here. I feel like this is turning into a forever video, but it's a lot to cover. In any of these, I highly recommend you to write your alternative plan. So let's say we didn't go up on their blood pressure meds today. They said, hey, I don't want to go up on them. I want to really double down on my how I eat and my exercise, and let's just see how it's going. We'll meet up in 6 weeks. If it's still hanging out there, then I will start taking medicine. Write your contingency plan, write yourself a note there and be discussed with patient, wants to do this. Okay, great. Or if you're treating that sore throat and it doesn't go away, you'd write out your whole plan, starting this med, we discussed it. If this doesn't work, here's what we're going to do. Also, kind of give yourself a little bit of a guide in the future, or oh, this, cholesterol is borderline. Are we going to increase the dose, decrease the dose? Anything you've talked about with them, in terms of we might do this in the future, write that down. Any kind of education that you provided them, document that. Did you talk to them about the mechanism of their hyperlipidemia, anything? Document that. This is kind of your area to say, this is what I have done. So by all means, please tell them what you've done, but also don't chart too much because you're going to lose your mind. Now let's go to our alternative universe really quick with the sore throat. With those other 3, we really know what they are. We know what we're dealing with. But let's say you have your sore throat. Under line 1, that's usually the status of things. If we're doing line, sore throat, pharyngitis. Line 1, since it's the status of things, I will usually write, and this isn't, you don't have to do this. This is just what I do and what I have found with the woman I work with. She's kind of done it this way, and I've seen a lot of my preceptors do it this way, and I think it's helpful. By all means, with all of this, you don't have to do it this way. But I will write sore throat, DD, so differential diagnosis, and I will write pharyngitis, and this is where I write my differentials we talked about up front. Period. Symptoms and presentation most correlate with strep. We're going to work with that. And that would be if you're unsure, maybe you don't have strep swabs in your office. If you do, positive strep test. But let's say you don't have it in your office, but they had their Centaur criteria was off the charts and you're yeah, friend, you have strep. We're going to treat you. But that's where I put my differentials. So later I can look back, and if it doesn't get better, I can be like we did all this. This is what else I was kind of thinking about. And then go through all your treatment. And at the bottom, you can be like, if this doesn't resolve, like, please follow up within I'm going to follow up with them within 48 hours. If it's not improving by then they should really call us. And here's what else I'm thinking. And here's what else we could possibly do. Other examples of this would be like low back pain related to likely strained muscle. But here, hey, if this is not feeling better, we would expect it to feel better within 6 weeks. If it doesn't, we're going to refer to ortho, or we're going to get imaging of the back of some kind. This is where you're writing your whole plan and what's going on in the back of your mind, kind of, so that you later, when you look at this note and you're like, what was I thinking? You can be like, oh, thank you, past self, for explaining what you were thinking in this moment, because you have in your back of your mind, you're going to have a bunch of different things going of like, here's, the next steps of what I need to do. And it's so nice to your future self when your future self looks at that and you're like, oh, it didn't work. Here's what I do instead. Or if someone else is seeing that patient for you, maybe you're sick or you don't have your own panel, they can be like, oh, this didn't work, and here's the next step that we're going to take that was already discussed, and it kind of just makes everything a little bit easier. Okay, so next sections are more just notes to you. This would be orders that you're putting in the computer. Are you ordering any labs? We're going to order some like we talked about. Are they fasting? Are they non-fasting? Make sure to tell them that. Any imaging that we need to order? We're not doing that today. Are we referring them anywhere? We can put those referrals in. We are not. And at the very bottom would be more of just a note to you. This is not in an electronic health record. This would be mostly just like a note that's helpful while you're on paper. It's new meds and changes. This will be something that probably gets printed out for them on an after visit summary, but just to remind you like, okay, this is what we changed today. So that's why I'll put it on here. The last two will be in your electronic health record. It's follow-up. So when do you want them back? And make sure to have the reason for the visit. And then last but not least, the visit code. So we are going to code this a 99214. If you are in clinical, you would want to ask your preceptor, what are we coding this as? Because you then have to tell Typhon or whatever charting, like logging your patient clinical hour things is, it's going to ask you that. Okay, guys. And that is a review of how I chart. Quick tips to make this like a little bit easier. I know this video is like a bajillion years, so I'm going to try to go fast. I promise. 1. Things I always chart before I move on to the next patient. I always try to have some kind of a skeleton of a review of systems. I really try to have it in its final form before I leave the room. 2, I always have their pertinent, like we talked about, not all of them, but the pertinent review of systems and physical exam findings, because you're not going to remember that if you have to go back and close this chart later. And I always type out I have the whole treatment plan done. I will make sure to take the few minutes and just get the whole treatment plan all written out. I'll put in all the labs and I'll send all the meds. That way I know, like, from their end, they're not waiting to get a call from CVS to find out that, oh, I jumped into the next room. It takes a couple minutes, yes, but it saves you so much confusion on the back end. And at the end of the day, if you're trying to close out all your charts, it makes it so much easier. Next, templates. Templates are your best friend. I didn't discover them until recently, and I am sad. This is something that either your computer will already have. I like to make my own. Every computer system is going to be different for making their own templates. I will eventually make a video all about templates because that is a whole rabbit hole, but use templates, my friends. Make them for any and everything, but templates are amazing. You can ask your preceptor or Google or YouTube how to make templates. Here, when I eventually make a video on it, I'll link it, but we would be here forever. But use templates. 3, if your charting system lets you merge in past encounters that are similar to this one, because that's going to fill in almost everything for you. Like if this person had a med check 3 months ago for the same thing, you can merge in with most of the things, like all of that info from the last appointment. So you're not starting from scratch. All you have to go then in and do is tweak the things that are a little bit different, in the HPI and whatever they're coming in with. But it's only a couple things that you're having to mess with, not everything. Hello, it's Liz of A Few Minutes Later, when I realized I totally forgot to say something. My baby is now up, so she's here. One other thing that's really, really helpful with writing notes is you are going to find your own style. This was just an example of what I do and what I really like, but you are going to find your own style and do that by reading a bunch of other people's notes. This was mostly for outpatient. It would certainly apply inpatient, but inpatient notes are going to be a lot different as well. So read through notes wherever you work. Read through other people's notes and see what you like and see what you don't like. You're going to learn a lot about what you like to include in yours and what you don't, and how you kind of want to proceed. I've picked, I've kind of adopted a style from a lot of different ones that I've seen. And this is what I've landed on. So this is certainly it's kind of weird, like a weird art art form. But the easiest way to get ideas and get more comfortable with writing all of these is just by looking through other people's and seeing what works for you, what doesn't, and it kind of gives you a template to go off of. Does that sound about right, Piper? Yeah? Great. All right, my friends, and that is how I document my soap notes. It's a very long video, and some tips and tricks. Hopefully they help you. If you have any other questions, feel free to leave them down below. And if you have any advice of how you write notes or document or save time, please let me know, because I'm 2 years into this and I am still slow, friends. I am slow. So any advice, also, you guys learn so much from each other. I so appreciate you if you've made it this far. I certainly hope it was helpful. If you want to see other videos about this type of stuff or life type of stuff, I have weekly vlogs on Saturdays and content videos on Tuesdays and Q&As sprinkled within there. So make sure to subscribe so you can see more. I hope you have a fabulous rest of your day, and my brain is dying. What's next? Have a good week. Have a good week, guys. Bye.